Dear student, welcome to my channel. Today I am going to discuss about one of the respiratory infection, that is pneumonia. So it is inflammation condition of the lung which is caused by the microbial agent. Microbial agents such as either bacteria, virus, protozoans, fungal. So any of these which is causing the infection in the lung. So that is known as pneumonia. So let us move on to the definition. It is an inflammation of the lung parenchyma. So it is, as I told, infection which is caused by the microbial agent, mainly the cells which are present in the bronchioles and alveoli. So in the bronchioles and alveoli, parenchymal cells are affecting from the bacterial infection and causing the pneumonia. Incidence is nothing but how many peoples are affecting with the pneumonia. Approximately 450 million peoples in a year in affecting from the pneumonia in the world. Okay, then around 120 million peoples are suffering with the pneumonia in India. Then it is the fifth leading cause of death. Then it is more common in children's and age group of more than 75 years. Because of lack of immunity power, it is more in children's and more common in age group of 75 years. Let us move on to the classification of pneumonia. So classification can be done based on the causative organisms. So causative organisms are nothing but bacteria, virus, fungus and protozoans. So in this first one is bacteria. So if the person has getting pneumococcal pneumonia which is caused by Streptococcus pneumoniae bacteria. Then if the person has suffering with Staphylococcus pneumonia, means the person having infection of Staphylococcus aureus bacteria. Then if the person is having influenzal pneumonia, means he may have infection of Haemophilus influenza bacteria. Then if the person is suffering with gram negative bacterial pneumonia, means he having Klebsiella bacterial pneumonia. So these are the bacteria which are causing the pneumonia, like Streptococcus, Staphylococcus, influenza and Klebsiella. So let us move on to the viral infection. So as we all know that the main viruses are rhinovirus, coronavirus, influenza virus and adenovirus. So these are the four viruses. Around 90% of pneumonia will be caused by the viral infection. Then in the fungal infection, the histoplasmosis fungus, blastomycosis and candidiase. So these are the funguses which causing the pneumonia in the respiratory tract. Then parasitic such as protozoans and nematodes. So these are the four classification of pneumonia based on bacteria, viral, fungal and protozoas. So let us move on to the next, that is based on the environment. So based on the environment, first one we have community acquired pneumonia. So as name itself only, community acquired pneumonia is nothing but the pneumonia which is occurring from the outside of the hospital. Like outside of the hospital is nothing but we are getting pneumonia from the community side, either home side, either any of the health care settings we are getting the pneumonia. So it is nothing but other than the hospital side we are getting pneumonia. So next one is, that is hospital acquired pneumonia. So hospital acquired pneumonia is nothing but name itself only, we are getting pneumonia when the admission of the hospital stay after the 48 hours. If the person has got the admission from the some of the illness, but after admitting the 48 hours of the hospital stay, the person may develop pneumonia because of hospital infection. So that is nothing but hospital acquired pneumonia. So next one is, that is health care associated name. So the person is getting pneumonia because of health care workers. So that is nothing but health care team. So if the anyone has touching the before washing or after washing the hands, the healthcare team members are touching the patient means, so that spreads the infection from one person to the another person. So next one is ventilator associated pneumonia. So ventilator associated pneumonia is nothing but pneumonia is occurring more than 48 hours after the patient have been incubated. So when the person get incubated after the 48 hours, the person may develop pneumonia because of ventilator infection or because of AT tube infection. He may develop pneumonia. So lastly, that is aspiration pneumonia. Aspiration is nothing but we are getting aspirated from the any kind of foods or any drinks or any kind of inhaled smoking. So because of that reason, it stuck in the lungs and causes the aspiration pneumonia. So these 5 types based on the environment. Again I will come once again: community acquired pneumonia, hospital acquired pneumonia, healthcare associated pneumonia, ventilator associated pneumonia, and aspiration pneumonia. Then lastly, the classification which is based on the site. So in this we have lobar pneumonia. As we all know, in the lungs we have 5 lobes. Okay, so any of the lobe has been affected from the infection, so that is called as lobar pneumonia. So any of the lung, either upper lobe, either lower lobe, either central lobe, so any of the lobe is affecting from the infection, and so that is called as lobar pneumonia.